Doctors were first baffled by the little boy's jaw's constant growth. At last, as they peered inside his lips, they started to understand what Thomas was going through. Both Emily and Jake stared at their adorable son. He resembled his elder brother Lucas in appearance, with the exception of a somewhat larger upper jaw. Apart from that, he seemed flawless. Emily only discovered he had trouble holding the milk in when she attempted to nurse him. Despite the nurse's assurances that everything was okay, Emily's maternal instincts told her that her kid was not feeling well. She waited calmly the next morning for the pediatrician to arrive on his rounds. She would ask him to look at young Thomas's nose and lips, even if it was only for her personal comfort. She was certain by now that he was having more difficulty breathing than he should have. Dr. Franklin didn't appear worried about Emily's newborn boy when he presented himself to her that morning. To be sure nothing was amiss, he chose to examine her son after learning that he was coughing up the majority of the milk. His eyes, however, widened as he gazed into Thomas's mouth. He informed Emily without more explanation that he would need to bring the infant to his consulting rooms in order to perform a comprehensive checkup because he needed certain equipment. Even though her little son would have to travel alone, Emily agreed to the examination. Jake, her husband, was unable to go with their child since he was back home with Lucas. Because of the severe discomfort from the C-section during delivery and the fact that she was still hooked up to IVs, she was unable to leave the hospital bed at this time. She watched with sorrow as the nurse escorted the doctor to his office after wrapping her son in a special blanket. Even though it seemed like hours passed, the doctor merely showed up at the doorway 25 minutes later. He requested that she call her spouse so that they could speak together. Jake would tell them what he found when he got there. Emily had started crying at this point. What had happened to her boy? His upper jaw was somewhat larger than she had anticipated, but suddenly it seemed as though they were awaiting a death sentence. Jake hurried to her side to console her and find out what was upsetting the doctor. When Dr. Franklin did speak, he had a clear solution in place along with some unfavorable news to deliver. Thomas had a little hole on his palate, which he discovered. The family was lucky that the outside lips were completely intact, and it was not as noticeable as it could have been. The palate had not closed well throughout embryonic development. The youngster was experiencing mild eating issues, which were caused by this. The physician began informing the parents about the necessary procedure. However, as the majority of repairs are often made between 6 months and a year following birth, the treatment may only be performed later. Since every kid develops differently, it was only possible to establish the best timing for the surgery as Thomas developed. Both Emily and Jake were obviously shocked, but they chose to remain upbeat and concentrate on all the blessings for which they were grateful. Establishing a good feeding schedule required some adjusting, but overall, the family was doing well. The next week was their planned vacation, but they decided to postpone it until they were more accustomed to the difficulties they were now facing. The family returned home after a week in the hospital. Emily sought to ignore the truth at first, but tiny Thomas's upper jaw seemed to keep expanding, and eventually she was unable to do so. The size of the upper and lower jaws differed greatly when viewed from a side profile. Dr. Franklin agreed that the family should see a specialist on the follow-up appointment after 2 months. Something more important was obviously happening with Thomas's mouth. Even though he appeared to be a healthy youngster, his parents were no longer able to ignore his unusual traits. Everyone saw the tiny boy's constantly expanding upper jaw, but family and friends were reluctant to react. After seeing the craniofacial expert, the parents received an odd diagnosis they had never heard of before. The physicians were astounded by what they discovered within Thomas's mouth when they inspected it. Thomas was diagnosed with a condition that had no family history of anything even quite similar. Emily and Jake were informed by doctors that their son had a disorder called Pierre-Robin sequence. Since the tongue was a bit farther back in the mouth, this explained the cleft palate, which was frequently linked to the disorder. It also reinforced Emily's suspicion that her son had trouble breathing. The expert clarified that the lower jaw was undeveloped, which caused the face to seem lopsided, but at first it appeared that the upper jaw was growing too quickly. Though at distinct rates, both jaws were expanding.
In order to give Emily more advice on how to keep milk from getting into her baby's nose, the doctor called in a feeding therapist. To reduce the risk of asphyxia, babies with this syndrome needed to be closely watched. Until young Thomas was old enough to have surgery, the family would have to handle the issue. Fortunately, they believed that he only experienced a minor variant of the sequence. Emily felt reluctant to ask another inquiry. She finally admitted to the doctor that she felt as though her son was biting her when she fed him. After examining the young kid, the doctor informed the parents of what else he had found. 2 natal teeth were concealed in the smaller lower jaw. Since there was no rational justification for their existence, the doctor had to remove them. They were also able to cause tongue injuries due to their poor quality. The woman would find it simpler to nurse if those teeth were removed. It was alarming to learn that possible heart and eye impairments were among the other issues directly linked to this illness. Thomas's parents needed to take him for 2 more tests. Thankfully, the results of these tests were available right away. Emily and Jake couldn't contain their tears when the doctors informed them that their baby's heart was healthy and that the eye's anatomy appeared to be in order. Even though they were having difficulties, they had a lot to be grateful for. Nevertheless, Emily and Jake had to deal with a lot of strong feelings. They would do all in their ability to help their little son, even though they were not emotionally ready to have a kid with any medical issues. They needed to be strong and concentrate on all the good things in their lives for his sake. They were prepared to take on the future as a family. There was some potentially positive news that morning, despite the parents' heartbreaking announcement. Sometimes, when a youngster gets older, the situation of their jaws growing at different rates resolves itself. Although doctors couldn't guarantee anything, this appeared very likely in Thomas's situation. The family would be able to determine within the first year of their son's life if further surgery to extend the lower jaw would be required, even though the cleft palate would not heal itself. The group of craniofacial experts closely monitored Thomas. The procedure to seal the little hole in his cleft was prepared by the time he was 7 months old. Doctors recommended that Thomas be given time to develop normally at that point in the treatment plan, with the expectation that his jaws will mostly straighten out on their own. His appetite grew, and he began to put on weight after his palate was corrected. He reached all of his developmental and growth milestones on time. Doctors verified that by the time he was 2 years old, his facial equilibrium was correcting itself, suggesting that the family would not need to have an extra treatment to get the lower jaw longer. As time went on, if the family felt that cosmetic surgery was required, it would always be an option after he reached adolescence. He was as healthy as he could be for the time being, and his parents could finally relax and start a new, happy chapter in their life. Before seeing this video, were you aware of the Pierre-Robin sequence condition? Have you ever known a youngster that needed surgery so early in life? Tell us in the space provided below. I appreciate you seeing, and I hope to see you in the future video.